Once you have carried out your consultation asking open questions to establish your guest's needs, next you will choose the 2 most appropriate treatment oils. Using your ring fingers, apply these to the back of the guest's hands at the same time, supporting the guest's arm at the hand and the elbow, and lead the hand to the guest's nose one after the other. Once they have chosen their preferred treatment oil, hold the product so they can see the name, whilst explaining key ingredients and benefits specific to them. Your guest is now on the treatment couch with décolleté towel and bolster placed. Your facial will begin with the eye and lip cleanse. Shake Bioactive Eye Cleanser well to mix the 2 phases. Apply Bioactive Eye Cleanser soaked pads to the eyes, simultaneously telling your guest it will feel cool and refreshing. Apply 3 deep clockwise circles, followed by 3 deep constant contact pressures. Pinch along the brows to portment movement across the zygomatic bone and continue the movement up to the forehead. 3 anti-clockwise circles. Leave the pads in place. Collect your second set of bioactive soaked eye pads and cleanse the lips, sweeping top lip and bottom lip. Holding the forehead with one hand and supporting the eyebrow, sweep the first pad inwards towards the nose, over the brow and to the temple. Halve the pad on the back of your hand and gently work down the lashes to remove mascara. Quarter the pad and sweep under the eyelashes from outer corner to the inner corner, and on the last sweep continue over the brow and finish at the temples with a light pressure. Now repeat to the other side. Sweeping the pad inwards towards the nose and over the brow to the temple. Halve the pad on the back of your hand and gently work down the lashes to remove mascara. Quarter the pad and sweep under the eyelashes from outer corner to the inner corner, and on the last sweep, continuing over the brow and finish at the temples with a light pressure. You will now repeat the eye movements using soothing eye lotion pads to the eyes only. Using appropriate cleanser, we are now going to perform the first cleanse. Apply cleanser from between the bust area, up the centre of the face, slide down the outside of the face, down the sides of the neck, across the décolleté and around the shoulders, rolling the hands forward to the décolleté, and repeat this movement 2 times. Upward circles with fingertips to the décolleté. Continue up the neck, jawline and chin. Scissor slides to the mouth. Continue with upward circles to the cheek. Slide one hand to the beginning of the eyebrow and the other hand slides around the zygomatic to the nostril. Work one side of the nose, circling upward. Repeat to the other side. Circles to the forehead and pressure on the temples to finish. Place warm mitts on the shoulders lightly and hold for a few seconds. Check the temperature is comfortable for your guest. Sweep one mitt at a time across the shoulders, pushing down on each shoulder, and finish by sweeping both mitts around the back of the trapezius. Continue to sweep up the front of the neck. At the jawline, turn one mitt while the other maintains contact. Repeat to the other. Work both mitts over the face simultaneously to the forehead, keeping one mitt in contact at the forehead. Work down the contours of the face using the other mitt. Replace the mitt to the forehead and repeat to the other side. Finish with a pressure at the temples. You will now carry out the skin analysis with the lamp. It is important that you engage in a natural conversation throughout, relating to the guest's concerns and giving appropriate solutions. Using your hand, sweep across the forehead, cheeks and chin, feeling for texture. Sweep your hand down the nose, feeling and looking for congestion. Next, turn the lights off and use the lamp to look for the colours showing on the skin and relate these to the skin condition and appearance. Remove the mirror from the guest and turn the lights on. Using your fingertips, gently pinch around the eyes, looking and feeling for skin firmness and elasticity. Using your thumbs, apply light pressures around the eyes, looking and checking for puffiness and dark circles. Gently lift the cheek, looking for firmness and horizontal lines, which indicate dehydration. Gently lift the jaw, observing for firmness and tonicity. Using the back of the hand, touch the cheeks, looking for sensitivity and redness. You will now move on to the second cleanse using enzymatic cleanser. Apply the cleanser from between the bust area, up the centre of the face, slide down the outside of the face, down the sides of the neck and across the décolleté. At this point, you will add a little water and repeat the application movements. Please note the cleanser is not to be taken around the shoulders. Continue up the neck, jawline and chin. Scissor slides to the mouth and continue with upward circles to the cheek. Slide one hand to the beginning of the eyebrow and the other hand slides around the zygomatic to the nostril. Work one side of the nose, circling upwards, and repeat to the other side. Circles on the forehead. Remove with 2 pairs of mitts, not taking them round the back of the shoulders. Blot the skin dry, gently using a tissue. Attach the nanodermabrasion cartridge to the pen, twisting securely into position. Set the depth at 1.75 and the speed to blue. There are 5 settings on the pen and this can be adjusted according to your guest's skin type and concern. The slowest setting, green, is the deepest. Ensure your guest's skin is completely dry, using the double tissue technique if required. Gently touch the guest's head reassuringly before applying the nanodermabrasion pen to the skin. Beginning at the forehead. Ensure the skin is taut and glide the pen over the skin with slow circular movements across the full forehead until gentle arrhythmia is present, applying gentle pressure. Once the full forehead has been treated, follow with draining movements from the centre of the forehead to the temple. Moving onto the cheek, chin and jaw, start from the side of the nose with small circular movements, working outwards towards the ear, covering the full cheek area, from the orbital bone down. Continue on the top of the lip, across the chin and jaw, covering the full lower facial area. Repeat circular movements over each section until the gentle arrhythmia is present. Finish with drainage movements across the area and towards the ear. Moving onto the eyes, switch the nanodermabrasion pen to turquoise. When treating the eye area, support the skin and gently apply flicking movements, working from the inside of the eye outwards across the orbital bone. Repeat this step along the brow bone, ensuring to continue supporting the skin. Repeat steps 6 to 9 on the opposite side of the face until the entire face has been treated. Moving down onto the neck, work one side of the neck at a time. With long circular movements, work outwards, ensuring the skin is always supported and taut and avoiding the trachea. Apply enzymatic mask to the face, neck and décolleté from between the bust area, up the centre of the face, slide down the outside of the face, down the sides of the neck and across the décolleté. Apply the pink hair and scalp mud to the scalp, not the hair, by parting the hair in sections and applying the product in one movement. Place thumbs side by side at the hairline and press with a gentle push forward, working backwards from the forehead. Place split thumbs working backwards in rows until the entire scalp is covered. Deep upward static rotaries. Stroking with flat palm of the hands from the heel to the fingertips, allowing the head to roll to one side. Move to the side and face your client to perform clawing, working from one side to the other. You can move yourself to the other side if you wish. Gentle hair tugging. Take a small amount of hair near the scalp and pull straight out with continuous alternate pulls from right to left. Then work to the back of the head, pulling each section. Now stroke with palm of the hands like before. Frictions. Gently stroking the hair, make sure you go all the way to the end of the hair. Ponytail push and pull and slowly slide off. For guests with short or no hair, place both hands to the side of the head and compress with gentle circles. Finish with a double hand crown circle and release slowly and gently. Mitt removal. Place warm mitts on the shoulders lightly and hold for a few seconds. Check the temperature is comfortable for your guest and sweep one mitt at a time across the shoulders. Pushing down onto each shoulder, finish by sweeping both mitts around the back of the trapezius. Continue to sweep up the front of the neck. At the jawline, turn one mitt while the other maintains contact and repeat to the other. Work both mitts over the face simultaneously to the forehead, keeping one mitt in contact at the forehead. Work down the contours of the face using the other mitt. Replace the mitt to the forehead and repeat to the other side. Finish with a pressure at the temples. Dampen 2 gauze pads with cleanse and recovery spray. Hold the dampened gauze pads at the temples and wipe gently but thoroughly across the skin. Ensure you move down the face with even pressure and long movements. Work the gauze pad over the décolleté, neck, jaw and face, and finish with a pressure at the nape of the neck. You are now ready to apply the hydrogel and wearable LED boost mask and patch. Remove hydrogel carefully from sleeve. Remove protective layers from the bottom half and apply to the lower face. Gently stretch into the shape of the face. Apply the top layer, being careful to just slightly overlap. Please note the hydrogel can be torn at the nose to help position accurately around the eyes. Apply soothing eye lotion soaked pads to the eyes. Position the Boost LED patch onto the décolleté. The controller should be attached to the cable. Carefully pick up the cord, the strap, the controller and the sides of the Boost LED mask with both hands. Ask your guest to raise their head slightly to allow for the loose end of the strap to slide underneath their head. Gently place the Boost LED mask onto the guest's face and with your left hand hold the Boost LED mask in place. With the other hand, take the unsecured end of the strap and Velcro around the larger silicone loop, ensuring the mask is fitted comfortably and securely. Place your hand onto the guest's shoulder and inform them you are now turning on the Boost LED mask and patch. Reassure them that the light will appear bright when first activated. However, the eyes will adjust to the glare in around 40 to 60 seconds, at which point the light becomes a nurturing glow. Activate the Boost LED mask and patch. Place controller towards the top of the head and ensure the cable and controller is secure. Hand and arm massage. Starting with the right arm, glide from hand up to the shoulder and back down. The length of hand and arm should be in full contact during the movement. Repeat movement back up to the shoulder. Support guest's arm and sweep the free arm under the shoulders and back hand momentarily cups the opposite shoulder. Knead and knuckle the trapezius, neck and scapula. Glide back down to the hand and repeat the movement up and down. The length of the hand and arm should be in full contact during the movement. Lift and support the forearm and apply thumb pressures gliding up the inside of the forearm 3 times. Alternate thumbs massage the inside of the wrist 3 times. Alternate thumbs knead the palm to relieve any tension 3 times. Turn the hand over and alternate thumbs massage the joints of the wrist 3 times. Small circular movements work down the hand and fingers, starting at the little finger or thumb. Apply pressure and pull at the nail. Glide from the hand up the shoulder, and the full length of the hand and arm should be in contact during the movement. Support the guest's arm and sweep the free arm under the shoulder and back. Hand momentarily cups the opposite shoulder. Glide back down to the hand and repeat the movements up and down. Finish with light feather movements down the arm and replace the towel. Now repeat to the other side. Once the full 10-minute treatment has been delivered, remove the Boost LED patch first, followed by carefully removing the Boost LED mask, ensuring that you do not bump the guest's face. Finally, remove the hydrogel and cotton pads in one efficient movement. Treatment oil application. Begin with inhalation. Hold cupped hands over the nose and allow the guest to enjoy the chosen aroma. Place the hands at the centre of the décolleté and apply the oil by gliding slowly towards the shoulders, down the upper arms to the elbow and back up to the shoulders, around the back and across the trapezius. Roll hands forward and place back onto the décolleté. Apply a little more oil to the hands and forearms for oil application to the face. Place forearms at the jawline, either side of the chin. Your elbow should be towards the chin. With light pressure and one continuous movement, slowly slide forearms and the hands up the jawline and face, stopping at the temples. Glide down the sides of the face and the jaw and then back up to the ears. Down to the mouth with scissor fingers and back out to the ears. Down to the mouth with scissor fingers and back out to the ears. Glide under the eyes, up to the nose and finishing with strokes to the forehead. Glide back down the sides of the face and place the hands at the centre of the décolleté. Sweep the forearm and flat palm across the décolleté left to right and then right to left, repeating this movement 2 times. Glide hands from shoulders down the upper arms to the elbows. Move slowly up and down the upper arms from the shoulder to the elbow in a wave-like movement. Repeat this movement 3 times. Knead and knuckle the upper arms and repeat this movement 3 times. Knead around the shoulder, rotate a cuff and repeat this movement 3 times. Sweep under the shoulders to the trapezius and knuckle across the trapezius and now repeat this movement 3 times. Roll hands forward and place back onto the décolleté. With both hands, create 3 slow circles onto the décolleté, and each circle becomes slightly bigger than the previous. Sweeping hands up the neck and onto the jawline. Upward circular movements massage across the jawline and under the cheekbone, exploring the lower half of the face and working on any areas of tension. These can be small and bigger circular movements. Repeat these movements 6 times. Slide back down to the jawline and now move across to the left side of the face. Alternate hands glide flat palms from the jaw to the temple with slow upward strokes, and the hands follow each other without losing contact. Repeat this movement 6 times. On the 4th stroke up the face, continue the hand around the full face, bringing it back to the side that you are treating. Place your middle finger of your right hand under the jaw, index finger above it and move along the jawline with pressure. With your left hand following your right hand in a V shape, repeat this movement 3 times. Remain on the left side of the face and using both hands, lift, knead and sculpt the jaw and cheek with backward C movements. Repeat these movements 3 times. Creating thumb walls and lifting the cheek towards the thumbs, working across the sides of the face. Repeat this movement 3 times. Slowly separate your fingers, thumbs and using the index, middle and ring fingers, lightly flick the cheek with guitar fingers. Keeping your fingers relaxed and slightly bent, they should not be stiff and straight. Increase the speed of the fingers, working across the jaw and cheek and up to the temples. Repeat this movement 5 times. Alternate hands glide flat palms from the jaw to the temple with slow upward strokes. The hands follow each other without losing contact, and repeat this movement 3 times. And now move on to the right side of the face and repeat the steps. Now you will place both of your hands onto the temples. Using your ring finger, make small circular movements from the temples under the eyes. Sweep up the nose to the brows, flick your ring finger followed by your middle finger and then your index finger, and repeat circular movements and finger flicks 3 times. Now you move on to the forehead, and with your middle finger on your right hand and index finger and middle fingers from your left hand, create slow frictions across the forehead, repeating the movement 6 times. For the final movement to the face, with alternate hands, stroke the forehead with palms in one continuous wave-like movement. Repeat this movement 6 times. Now move back onto the temples and slide down to the jawline, the neck and down to the centre of the décolleté. Glide slowly out to the shoulders, down the upper arms to the elbow and back up around the shoulders, across the back and finish at the occipital bone at the nape of the neck. Hold the soaked Spa Fresh cotton pads over the nose for a few seconds so the guest can smell the aroma. Work the cotton pads over the face, neck and décolleté, finishing with a pressure at the shoulder. Apply Triactive Lift and Firm Eye Serum if appropriate. Press appropriate face serum to face, neck and décolleté. Apply appropriate eye moisturiser. Apply appropriate moisturiser. Apply Pomelo lip balm or nourishing lip treatment.